On average, in the UK, one person dies from accidental carbon monoxide poisoning every single day. We frequently hear about tragedies in leisure situations, in boats, in tents, and in caravans. They all provide enclosed spaces where the potentially deadly gas can build up quickly if there's insufficient ventilation. Carbon monoxide, or CO, is a potentially deadly gas that's odorless, colorless, and tasteless. It has the capability to cause serious neurological damage and can kill in a very short time. It's notoriously difficult to detect, and those who've received a dose of CO poisoning are often misdiagnosed as having flu or even food poisoning. There are a variety of sources of carbon monoxide poisoning. They include the improper or incomplete burning of natural gas carbon-based fuels such as propane, butane, gasoline, kerosene, wood, coal and charcoal. A yellow flame is an indicator of incomplete burning. High and low-level vents being blocked to stop drafts lead to an increase in carbon monoxide poisoning cases during the winter months. Other sources include car exhausts, tobacco smoke, fireplaces and faulty chimneys, and fuel-burning gadgets such as space heaters and petrol engines. Gas appliances and heaters in small and enclosed spaces, and faulty central heating systems can also cause carbon monoxide poisoning, as can blockages in chimneys or other means of ventilation in enclosed spaces where fuel is burned. When carbon monoxide is breathed in, it can cause a loss of consciousness and suffocation. Breathing in a large amount of the gas can take a deadly effect in a matter of minutes, and it's particularly dangerous because it can kill you without you even knowing that it's present. The symptoms of poisoning can vary from person to person, but there are some common symptoms: chest tightness, fatigue, headaches, dizziness, nausea and vomiting, drowsiness, muscle weakness, and loss of consciousness. Those particularly at risk are the elderly, young children, pregnant mothers, heart or lung disease sufferers, those in high altitudes, smokers, and unborn babies, but everyone can succumb to the deadly gas. If caught in time, carbon monoxide poisoning can be reversed, but depending on the levels breathed in, it can result in permanent damage to vital organs such as the brain or the heart. The main treatment for carbon monoxide poisoning is oxygen therapy, which must be administered by an appropriately trained person. It will normalize the levels of oxygen in the blood, which have been displaced by breathing in the gas. There are two types of oxygen therapy. The first is 100% oxygen therapy, the most common treatment, which is administered via a tight-fitting mask. Sometimes mechanical ventilation is required with 100% oxygen therapy, and this entails having a tube inserted into the windpipe. The second type is hyperbaric oxygen therapy. When oxygen is administered in an enclosed chamber, it quickly reduces CO levels in the blood, so it's used in more acute cases of carbon monoxide poisoning to reduce the risk of permanent damage. Other treatments for carbon monoxide poisoning are dependent on the damage and the illness caused. When low levels of CO poisoning cause nausea and sickness, then drugs can be used to treat the symptoms. Fatigue can be alleviated with stimulants. And if the carbon monoxide has caused seizures, anticonvulsants can be prescribed. Let's summarize the key points of carbon monoxide poisoning. CO is a potentially deadly gas that's odorless, colorless, and tasteless. Poisoning has a variety of sources, including incomplete burning of gas and appliances being used in badly ventilated spaces. There are many symptoms of carbon monoxide poisoning which vary from person to person. Poisoning can be treated with drugs or oxygen therapy, depending on the level of inhalation. Carbon monoxide poisoning has mostly been associated with poorly maintained or vented gas appliances. In leisure situations, where people tend to be more relaxed and more unaware of risk, maintenance of gas equipment such as barbecues to avoid the incomplete burning of carbon-based fuels is very relevant. When carbon monoxide is breathed in, it poisons the body by displacing the oxygen levels in the blood. It reacts with the hemoglobin in red blood cells and forms carboxyhemoglobin, or COHB. The bond between carbon monoxide and hemoglobin is 200 times stronger than that of oxygen and hemoglobin. So the carbon monoxide is able to displace the oxygen levels in the blood with ease. The percentage of COHB in the body can determine the type of symptoms or levels of damage that may be experienced. Between around 10 and 30%, headaches, dizziness, fatigue, and flu-type symptoms may be experienced. At the next level, around 30 to 50%, people may suffer nausea, vomiting, headaches, and breathing difficulties. At over 50%, sufferers may experience loss of consciousness, seizures, and convulsions. At these levels, a sufferer can quickly die. You wouldn't think that something as innocent as a barbecue could actually kill. But sadly, fatalities have been caused by people being overcome by the carbon monoxide from barbecues. Barbecues should never be taken into an enclosed space. There's hardly any ventilation in this tent, so the risk of carbon monoxide is massively increased. Even though the disposable barbecue looks to be nearly out and could even be handled, the effects of the odorless gas could be deadly. In this demonstration, a nearly out barbecue is placed in the tent to see how quickly carbon monoxide can build up. After only 5 minutes, a CO detector shows levels of around 800 parts per million, enough to render occupants of the tent unconscious within an hour and dead soon after. These then are the key points about carbon monoxide poisoning in the leisure industry. Barbecues and gas appliances are potentially dangerous unless regularly maintained, used correctly, and properly ventilated. If breathed in, carbon monoxide displaces oxygen levels in the blood with ease, and sufferers can quickly die when oxygen levels become too low. And both disposable and gas barbecues should never be taken into an enclosed space, even if they appear to be nearly out. There are a number of precautions that can be taken to help prevent carbon monoxide poisoning, both in and around the home and when in a holiday environment. Ensure that you have all fuel-burning appliances checked regularly and by a trained and certified professional. This includes appliances such as gas heaters, cookers, boilers, and fires. Check chimney flues and vents regularly for blockages to ensure that burning gas emissions can escape through the proper channels. If possible, always opt for fuel appliances that vent fumes to the outside, and ensure that they're fitted and checked regularly by certified professionals. Always follow the instructions for the use of a fuel-burning device to the letter. Whenever required, open windows and doors when burning fuel to make sure that areas where the device is being used are thoroughly ventilated. Never sleep in a room that has an unvented or unchecked heater, and never use a gas stove or oven to heat your home. Don't burn fuel or use any related appliances in enclosed spaces where fumes can quickly build up. Look into using carbon monoxide detection devices, which can monitor unusually high levels of carbon monoxide in the air. The detector must always be positioned in accordance with the manufacturer's instructions. Some CO detectors are fitted with batteries, which will normally have a 5-year life, but the detectors need to be checked regularly and the batteries replaced when necessary. Be aware of the symptoms of carbon monoxide poisoning and seek medical assistance immediately if you experience these symptoms or come across anyone suffering from them. Carbon monoxide is a silent killer, and increased awareness in the dangers it presents will hopefully assist in preventing tragedies that have such a devastating effect on so many people. Stay aware and stay safe.